So if a person was having suicidal thoughts, what would happen if they were sent to a hospital? And would they be taken away from their family, from their friends? What would be happening to them?
It's really going to depend on where the circumstances are at that time. And so coming in to the hospital doesn't have to be a scary experience. The first step is going to be talking to a doctor about what's going on, what are your thoughts and your feelings, and then we kind of figure out what pathway we want to take from there. We can sign a safety contract or speak with your parents or caregivers and release you just a couple hours later. If you've already done self-harm or have intent to harm yourself, we may need to find you an acute psychiatric facility to get the help that you need.
How would a person know if they should go to the hospital?
If you're having thoughts that you just can't seem to pass and you don't have somebody there to help you work through that, the bravest thing you can do is come to the emergency department where we can keep you safe.
When you end up going to see a mental health provider or a psychotherapist, if we know what's going on beforehand, that you are suffering from suicidal thoughts, it is important to assess the level of suicidal thoughts, because some kids just have the suicidal thoughts, but they don't have necessarily a plan, or they don't have intent to want to harm themselves, but they kind of have those passive thoughts of, I wouldn't really care if I wouldn't wake up tomorrow. And so as a mental health provider, it's really my job to assess where are you at with those thoughts right now, and if it gets to a point where it is serious, where there is intent to harm yourself, that we create steps for you to be able to stay safe, and that probably will involve the caregiver. Even though it may be hard to talk about that with your parents, it's so important that they know so that they can be able to be there to support you. And it's my job as the therapist to be able to navigate that conversation, right? So you don't have to do that by yourself.